Hi, amazing family. Thank you so much for checking by. I'm so grateful that you have been able to follow through from the beginning of this very series on addiction. So, if you are yet to do so, you are just visiting for the first time, please do well to check for the concept of addiction. That's where the very series began from. All right, on this very video, we want to talk about the aspect of the consequences of an addiction. We are in a world of cause and effect. So, to every act, there is a repercussion. To every action we take today, there is an oncoming repercussion. So, substance abuse is not an exemption. So, therefore, these consequences can range from minute consequences to a major one. Indeed, there are actually far-reaching consequences that can result from the use of various substances in various aspects of the individual life. And we're going to be looking at these very consequences in six major aspects or six major areas of one's life. The first one will be to look at it from the physical perspective. So, the physical consequences of substance abuse involve things such as an addiction, all right, or overdose. So, the individual can actually overdose his or herself or his or her physical functioning, becomes addicted to the presence of this particular substance, whereby the absence of that substance causes a discomfort or dis-ease to that individual. The individual will not be at ease. The next one is that there are other health problems that could result, such as liver damage. We could also have heart conditions that can creep in from the use of this particular substance. All right. So we have increased risks of infection due to the poor immunity. And then with this increased risks, or sorry, with this poor immunity, there's possibility that other conditions such as HIV, hepatitis can actually step in. All right. So we also have malnutrition that can result from the use of several of these substances, more especially the alcohol class of the substance. All right. We have sleep disturbances that could come from it, especially the marijuana class of this very substance. Then we have cognitive impairment that can also result from the use of this substance. The second area we want to look at has to do with the mental and emotional consequences that can result from the use of substances. While the first one, anxiety. Anxiety is a complex display of emotion where you can't actually manage let's say there is a threat, an oncoming threat. You can't analyze it, or you can't interpret it, or you can't manage that very emotion. It will lead one to be anxious. All right, so you'll be tensed and in a state where you don't even know what next to do. It can actually result from the use of substances, which we call them psychoactive substances. We have depression. So most of these substances are actually depressive in nature. We have the mood swing as one of the consequences. We have said when we're talking about the signs and symptoms of someone who is actually abusing substance, we talked about the mood swing. A couple of these substances, because of its alteration on the normal physiological function of this individual, there is that possibility for mood swing to follow through, either in the presence of this substance or in its absence. The next one we want to look at is the aspect of personality changes that could result as one of the mental implications. The individual, if the individual was an outgoing kind of person, because we say that isolation is one of those signs to look out for, the individual might become depressive or someone that is reserved from the use of this particular substance. Then we could have someone, especially those substances that makes one elated. This individual is always hyperactive and so on, right? We have trauma as one of it. This trauma can result from the damage of the brain cells due to the presence of these psychoactive substances. We have suicidal ideations that can come from it because there is a cognitive impairment. Then there is bound to be that possibility for suicidal ideation. Next one has to do with the social consequence, which is the third area we'll be looking at. From the social aspect, the individual can have strained relationships, especially where persons who are close to him do not like the use of this substance. He cannot also take up responsible positions. He can also be entrusted with finances due to his use of substance. People will also isolate him, right? So we have social isolation as one of those major areas. Then the loss of friends and family can result from it, which is majorly in the aspect of the trust, okay? Difficulty in maintaining employment. If you remember in the aspect of the signs and symptoms to look out for, we talked about those persons having issues with absenteeism or going late, that's lateness to their work, all right, which can result from either hangover or overdose of this particular substance. So if it continues for a long time, the individual may lose that very employment or that very job. Now, the next one has to do with legal problems. A couple of these substances are actually linked with crime, and because of this, they can get themselves set up for an arrest. All right. So a lot of legal problems can result from this, including where they abuse, let's say, the minor or someone else in terms of sexual harassment, right? There could be issues with legal problem linked to that. The next one has to do with financial issues. I've already said they can't manage finance because any money that comes in, the next thing they think of or they want to do is to procure these very substances. The next one has to do with the homelessness for a couple of them. They don't mind setting up their homes as collateral to get as minute as a wrap of marijuana. That's how bad it is. Or a pint of cocaine. The next one has to do with legal consequences that comes along with this particular, which is the fourth area we'll be looking at. Now, there can be an arrest or incarceration resulting from either the shipping of this substance, these hard drugs, or being in possession of it. All right. Next one has to be legal fees and fines that you would pay, of which normally that money would have used for something better. Yourself, yeah, that's true. So the next one has to do with loss of driver's license for a couple of them, especially where there is the result of a preventable accident, or where they consistently have issues with accident. So they could lose their driver's license. Next one has to do with probation or parole. That can result from this because of the use of their substance. Maybe trying to prove their abstinence, if they can actually stay away from this substance, they might place them on probation at their place of work or any other instance, right? So we have mandatory treatment that could result from this. A couple of, let's say, as high as 70% of inpatients that are managed in rehabilitation came in due to mandatory treatment, not voluntary treatment, because their loved ones and other concerned persons are no longer okay with their behavioral pattern or their psychological manifestations. So because of this, there have to be mandatory treatment. And a couple of it may even come from law enforcement agency. So we have criminal record that can result from this, either in the shipping of this or possession of this very substance, or committing other crimes as a result of the influence of this particular hard drugs. The next one has to do with deportation, which is majorly for non-citizens. So let's say you go to another country, then you are found in possession of this hard substance or as a user of it, you will now commit a major crime or you're in possession of it. You could actually risk deportation. The fifth one, which we want to talk about, is the aspect of the financial consequences. So there will be that increased healthcare cost resulting from this. Yeah, there could be from that because you have to keep treating this infection, that illness, or the other. And then even the healthcare system too. This would have been preventable conditions. So in the outpatient or in the emergency department, they'll have a lot of casualties to actually manage, a whole lot of workload to manage because of this avoidable situation. Now we have the next one, which has to do with the loss of productivity and income. This individual, as I said earlier, if you remember in the signs and symptoms, a couple of them no longer think of something productive. They even rather prefer to even pass on. So because of this, they no longer think of any creative idea. All they are preoccupied with is the use of this particular substance, which renders them unproductive. Next one is legal fees and fines, which would have been money they would have saved. Damage to properties, can result from this. Hence, they need to fix them with monies that would have been used for something beneficial, theft or embezzlement, which is majorly on the aspect of other persons. So they can actually scam other persons, embezzle monies just to ensure they fit their substance use or their addiction. Next one has to do with the financial dependence on others because themselves cannot handle finance. So they need to continuously depend on other persons to help them financially. Bankruptcy can result from this. As I said earlier, they don't mind risking even a landed property for a wrap of marijuana or a pint of cocaine. That is how bad it is. So we have other consequences, which is the sixth aspect we should look at. Other consequences which we could look at. For instance, we have the academic underachievement. For a couple of them, either they can't perform well in the exam, they go late to even the exam hall or even lectures, or they find themselves involved in one crime or the other that have to be eradicated out of the school. And then they also have issues with even understanding the course because the cognitive function or perceptual functioning are altered. So they can't even be academically uh, useful. The next one, a couple of them, in fact, you find them, they are dropouts. Then we have the poor performance at work. Poor performance at work is actually eminent for a couple of them. Then we have increased risks of accident. So say the individual is high on this particular substance or is under the major influence of alcohol. There's that high tendency for them to have accident while driving. Then we have engagement in risky behaviors. Most of them engage themselves in unprotected sexual intercourse. A couple of them engage in rape. A couple of them engage in assault and other forms of crimes. All right. So we have the aspect of contracting infectious diseases. Most may not even contact it through sexual relations while under the influence. They might contact it while trying to use. Remember, we talked about one of those routes as being the intravenous. So while trying to use this intravenous route, they might find themselves sharing the syringes. And where one of them is infected, every other person becomes infected from the use of this particular substance. Unintended pregnancy can result from it, especially from the female aspect or from an incident of rape. Then we have death that can result from this. So substance generally are actually not advisable. It is something, in fact, it will not be out of place to say that the road to substance, the beginning of substance, is the beginning of an end of one's life, except when management comes in quite on time. Hence, we are pleading that just in case you know someone, you are a victim of this, directly or indirectly, of substance or an addiction, please drop a comment on this comment box and then let's see how we can engage each other towards the rehabilitation or how to quit this particular substance. And where you don't feel comfortable, please reach out to an expert so this particular menace can actually be handled. And then we'll, on the later run, see how to reduce its effect on the society. All right? And also, we are saying that don't rely on your ability. When we'll be talking about the aspect of managing this particular substance, you find out it's mostly difficult for individuals to quit on their own. So please seek for expert management. Thank you so much for staying this far. I want to appreciate my special family. You people are extremely amazing for all your support and all your time, for always checking up on my post and my content. I especially appreciate every one of you. God bless you all. And if you are new on this very channel and you are yet to subscribe, why not subscribe and turn on that notification bell so that when relevant contents like this drop, you'll be first person to view it. And then also give this particular video a thumbs up. See you on my next post. God bless you.